Good evening to all. We have just gone live with the webinar, so we have many people joining. We'll give just a minute while everyone makes that connection and we'll get started.
I see somebody has their hand up. I assume we'll be taking questions in the Q&A section, and if you have any technical trouble or other sorts of questions, please do use the chat. Be happy to
Yes, thanks for
help
that.
address anything.
Thanks for that note, Kate. So anyone can, this is a webinar format, so it's a little bit different than some of you may be used to on Zoom. The good news is only a handful of us will be on camera tonight and everyone else gets to sit back and listen in. And so if you want to communicate, again, use that chat box or the Q&A, and we'll be mindful in watching that. So without further ado, let's have a formal beginning to our evening. My name is Becca Steinhoff. I am the director of Wyoming Kids First, and I'm delighted to partner with several individuals this evening to co-host this webinar where we will talk about the COVID-19 vaccine and updated guidance for programs. And so thank you to the others who are on screen, though not on camera, with the Wyoming Afterschool Alliance, and the remaining team at Wyoming Kids First will be on this side to help troubleshoot any technical difficulties and offer some additional support. We also have Roxanne O'Connor and Nikki Anderson with the Department of Family Services on hand to answer any questions that may be pertinent from their realm. And we have Michelle Sullivan and Kate Foster from the Wyoming After School Alliance. So thank you to everyone, and we'll introduce our headlining speakers next. So we are very appreciative of the gifts of time from our State Health Officer, Dr. Harris, and a Senior Administrator from the Wyoming Department of Health, Stephanie Pyle. And they will be sharing information with all of us this evening and helping to answer questions as we move ahead. Again, use that chat box or the Q&A if you have something. If you submitted a question when you registered to attend, we did submit and share those questions, so we'll do our best to get those answered. You're welcome to follow up. This is being recorded and will be widely shared, so if you are watching via recording, know that you are welcome to reach out to Wyoming Kids First or the Wyoming After School Alliance with any follow-up questions, and we'll help direct and provide support to get those questions answered. So with that, as an introduction, Stephanie, I think we will hand it over to you and just look forward to the information that you'll share and the conversation that follows.
Very good. Good evening, everyone, and thank you, Becca. We're really pleased to be here this evening and to talk about this very important milestone in the pandemic. While we've spent the past year working on a number of issues related to the pandemic, including PPE, testing, contact tracing, and hospital capacity, we are really thankful that our efforts can now include vaccine administration. As you may know, if you're tracking our COVID-19 numbers, there have currently been 45,438 cases of COVID-19 in Wyoming and 662 COVID-related deaths. In recent weeks, we've been pleased that our case numbers are stabilizing and the number of hospitalized individuals due to COVID-19 has decreased. We've all faced so much over the past year, and the development of a safe, effective vaccine is a welcome event, as we all desire a return to some type of normalcy. Wyoming, along with other states, received their first vaccine allocation in December. Since that time, our teams have worked tirelessly around the state to administer vaccines to people throughout Wyoming. Unfortunately, vaccine supply remains low, and though supply is increasing, it likely will remain lower than we would like for some time. Due to the limited supply, we worked to establish a framework to determine who would receive the vaccine using a phased approach. You may have heard of this, but I'll go ahead and explain our 3 phases that we're working through right now. In our first phase, which is phase 1A, the focus was on administering the vaccine to healthcare workers involved in direct patient care and vulnerable residents of Wyoming's long-term care facilities. We also focused on first responders who may have regular exposure to COVID-19. Our priority group 1B for Wyoming generally includes people who are 65 years of age or older, some frontline essential workers who must interact with the public and who are unable to consistently physically distance, and people with certain high-risk medical conditions. Wyoming's goals for phase 1B include preventing death and illness, as well as keeping necessary activities going, such as food availability and educational services. And even though we will likely not reach phase 1C for a while, we have described those who are included in phase 1C so people can know what to expect. Phase 1C includes homeless individuals, people living in congregate settings, and other essential workers. We've made some changes to our priority phases as we've gone along, offering clarifying information, and will likely continue to do so when we realize that some clarification would be helpful or needed. Between what we track for state distribution and special federal efforts, we are really pleased to report that about 80,000 people in Wyoming have had their first shot. While overall available vaccine dose amounts remain low compared to high demand, we are seeing modest continued increases in shipments of the authorized vaccines, as well as more partners and providers coming on board to administer the vaccine. Roughly 100 providers across the state are administering COVID-19 shots so far, with more than 75 additional providers approved to participate as vaccine supplies grow. As of today, we've administered 85% of the first doses we've received and 67% of second doses we've received. What I want to share specifically with this group tonight is what childcare providers can expect. What we know from current reports as of today is that 9 counties have either started or completed vaccination of childcare providers. As you may know, each county is moving at their own pace, moving through the same framework and infrastructure that we prepared. But depending on the uptake, depending on the number of people in a given population, and depending on the allotment of doses, it varies from county to county in terms of which groups they may be working on specifically. So as I said, 9 counties have either started or completed vaccination of child care providers. For the remaining counties, we've partnered with DFS for a list of licensed providers. Our local staff will then be reaching out to child care providers when it's their turn to receive the vaccine. Unfortunately, we don't have predictions for when that will be, but we do expect it will be in the next several weeks. However, in some counties, it may take a little bit longer. We did have one question that came in today regarding whether family members of child care providers would be able to receive the vaccine when the child care provider receives the vaccine. And basically, if the individual is working in a child care setting, then the family member would not be eligible to receive it unless it's a home-based program and the family member is in the home at the same time as the children in that home-based program. If you have family members who are wondering when they may be eligible to receive the vaccine, we have information available on our website, and I can provide the link as soon as I'm finished. We also have county-specific information, so you can see at any given time where your particular county is in terms of the phases that I mentioned and how to register in that county. And I'll post that website as well. We know that for our older population or those who are not able to use a computer, we wanted to provide another resource as well. So we have an 800 number that I can post in the chat as well. That number is 1-800-438-5795. So most counties are currently working through phase 1B right now, and child care providers are, of course, in that 1B group. And that also includes those over 65, other frontline essential workers, and the others that I mentioned. It also does include certain underlying medical conditions. Some counties will be starting on those groups soon, while other counties, of course, may take a little bit longer to get to that group for the reasons that I mentioned before. like vaccine uptake, number of people in a given population, and the number of doses available. Fortunately for childcare providers, at this time, you don't need to take any action. We have, as I said, worked with DFS to get the list of providers, and our teams will be reaching out to you when the vaccine is available to you. So I just want to end by saying thank you all for joining this call today after a long day's work. We appreciate all you do for children and families in Wyoming, and we just appreciate your time and your interest in this important resource as we continue to work through all the factors affecting us during this pandemic. And with that, I'll go ahead and turn it over to Allie.
Thank you, Stephanie. And there's one question that Becca put in the chat about clarifying when we say child care providers that we're including after school and similar child youth serving organizations. So that is correct, that those types of organizations are also included.
Right, very good.
Well, hi, everybody. Thanks again for joining us this evening, and want to also express my thanks for really just the incredible work that you've done for almost a year now. It's hard to believe that we are a year into this, but we are, and just really want to express my thanks. I am going to try to share a slide presentation. Please let me know if you can't see this. But my plan for this evening is really just to go through these vaccines and what they are, how effective they are, who should and shouldn't get these vaccines, and of course, answer any questions you might have about them. So I'm sure you've heard the names of these two vaccines. They are Pfizer and Moderna. Those are the two vaccines we have available now and are administering in Wyoming. Both of these vaccines are mRNA vaccines. And so how do mRNA vaccines work? Essentially, these mRNA vaccines are a blueprint. They carry a genetic material that essentially teaches our cells how to make a small harmless piece of what's called the spike protein, which is found on the surface of the virus that causes COVID-19. So an image of the virus called the SARS-CoV-2 virus is on the right here. And this spike protein is the little triangular piece of protein that's sticking out in red. So this protein is what helps the virus bind to our cells and enter our cells so it can replicate. Because it sticks out of the virus, it's also what our immune cells recognize and form an immune response to, and how we fight off the virus, and ideally, how our immune system is prepared before we even see the virus using the vaccine to be able to combat the virus once we are exposed to it. So when our cells make this small harmless piece of the protein, they display it on the cell surface. Our immune system recognizes it as something different from what's usually in our bodies and starts to form an immune response. It's important to note that, all of these vaccines contain is the blueprint to make a very small portion of the virus. So these vaccines themselves cannot give somebody COVID-19. They also can't make somebody test positive for COVID-19. So how are these vaccines developed? These vaccines were developed in the same way that all vaccines were developed, through multiple phases of studies and trials. All vaccines go through phase 1 trials. It involves a small number of volunteers. And the main question in these early trials is to just answer, is the vaccine safe? Are we seeing any serious side effects? Once those trials are completed and the vaccines seem safe, they go into phase 2 trials that involve several hundred volunteers. This gives us a better understanding of, what side effects can we expect from these vaccines, and also help us measure whether our bodies are producing an immune response to these vaccines. And then finally, phase 3 are really the clinical trials where we include thousands of people. And here we really want to understand, do these vaccines prevent us from getting the disease, in this case, COVID-19, as well as ensuring that these vaccines are safe. And then in phase 4, scientists review the data that the clinical trials produce and determine whether the vaccine should be used in the population. So both the Pfizer and Mrna vaccines and any COVID-19 vaccines that will come out in the future will have gone through this entire process. COVID-19 vaccines are held to the same safety standards as all vaccines. So these are just some details of the two vaccines and the trials they went through. For the Pfizer, they had over 45,000 people enrolled in 150 sites in 39 states. And the Pfizer vaccine was shown to be 95% effective at preventing people from getting sick with COVID-19. The Mrna vaccine involved 30,000 people in the phase 3 trials, again, 89 sites in 32 states, and it was shown to be 94.5% effective in preventing getting sick with COVID-19. So very, very pleased and excited to see these effectiveness numbers. I will say that they are greater than I think any of us had dared to hope. And a very good sign that these vaccines are going to prevent us from getting sick with COVID-19 and help us start getting back to normal. And then just a little bit about the specific process that these vaccines went through after these clinical trials that I just talked about. So these vaccines are actually reviewed by two independent scientific committees to first determine whether they should be authorized for use by the public. That first committee is called the Vaccines and Related Biological Products Advisory Committee. And they work or they advise the FDA on whether to authorize a vaccine for use. And then it goes through a second committee of independent scientists from a variety of disciplines, pediatrics, infectious diseases, OBGYN, to make recommendations for the use of the vaccine in the population. And this second committee is called the Advisory Committee on Immunization Practices. And only after review by these two independent scientific committees are these vaccines authorized and used in the public. So some specifics about these two vaccines. Both the vaccines require 2 doses. The Pfizer vaccine requires 2 doses, 21 days or 3 weeks apart, and is authorized for individuals 16 years of age and older. The Mrna vaccine is also 2 doses, but 28 days apart or 4 weeks. And it's authorized for individuals 18 years and older. And the difference in 16 versus 18 years old is really just who was included in the trials. It is likely that Mrna is safe in individuals that are 16 and 17 years old. We just need to make sure that we're including those individuals in the trials to know that we can make that conclusion. The second dose should be given as close to the recommended interval as possible, so as close to the 3 weeks for Pfizer or 4 weeks for Mrna as possible. We realize that life happens and sometimes things get delayed. And so we have some leeway up to 6 weeks after the first dose to get the second dose. But really, as much as possible, we should try to get those second doses on time, because that means that people will be protected sooner. The vaccines are not interchangeable. The second dose should be the same brand of vaccine as the first dose. And this is really because we haven't studied these two vaccines together. It's unlikely to be dangerous to get 2 different types of mRNA vaccines, but we know that these vaccines work when you give the same dose of vaccine twice. So we should really try to get the same vaccine twice and not switch vaccines. It is recommended that these vaccines be given alone and to wait 14 days on either side of the COVID vaccines before getting other vaccines. And that's really just, again, we don't expect it not to be safe to get multiple vaccines at once. It's just that we know that these vaccines work best, or we know that these vaccines work when they're given alone. And then, as I mentioned before, COVID vaccine cannot give you COVID-19 and won't cause people to test positive for COVID-19. So who can get the vaccine? For all vaccines and really for all types of medications out there, there are what's known as contraindications, and those are who should not get the vaccine. And for these vaccines, it's really only a small group of people. It's individuals with a history of a severe or an immediate, meaning an allergic reaction that happens really fast after getting the vaccine. So any allergic reaction to a previous dose or your first dose of an mRNA COVID vaccine, or allergies to any of the vaccine components. Now, these vaccines are pretty simple. They're basically only comprised of the mRNA, some fats, and then some water with some salts and sugars. So allergies to any components of these vaccines are going to be very rare. And if you haven't had an allergy to another type of vaccine or any type of injectable medication before, it is very unlikely that you're going to have an allergic reaction to these COVID-19 vaccines. Precautions are, so those are really the only contraindications, the only people who shouldn't get the vaccine. Precautions are conditions that a person might have where it's best to consult with a healthcare provider before getting the vaccine. And for these COVID-19 vaccines, precautions include individuals with a history of any immediate allergic reaction to any other type of vaccine or injectable therapy. In most individuals who have a history like this, it's going to be safe to get the COVID-19 mRNA vaccines, but it is good to talk to your healthcare provider. Importantly, other types of allergies are not a reason not to get the vaccine. So people who have food allergies, pet allergies, venom allergies, environmental allergies, or allergies to oral medications, it is safe for them to get the mRNA COVID-19 vaccines. So what if you've had COVID-19 in the past? People who've had COVID-19 can safely receive the vaccine. There is some language out there from CDC that says people who've had COVID-19 can choose to delay their vaccination for up to 3 months after their illness. That's because we know that people who actually get COVID-19 are immune for at least 3 months. And so in order to preserve vaccine for other people, you can choose to delay it for 3 months after your illness, but it's not required that you do so. People who currently have COVID-19 should wait until they've recovered from COVID-19 and have been released from isolation. And there are really 2 reasons for this. One, as you know from other vaccines, it's not recommended to get vaccines when you are ill. And second, we don't want to expose the people who are giving vaccines to COVID-19 if we can avoid it. So if you currently have COVID-19, the advice is to wait till you've recovered, and then you can go get the COVID-19 vaccine. People who have been exposed to COVID-19 and in quarantine, we also ask them to wait until their quarantine period is over before they get the vaccine. That's again to protect the people giving vaccines and to make sure we're not exposing them. The exception to this is people who are living in congregate settings like nursing homes. If they have been exposed, they can still get vaccinated because they are being seen by healthcare providers regularly anyways. Some individuals who have COVID-19 receive what's known as antibody therapies. You'd likely know if you've received this. It's an injection either when you're in the hospital or prior to needing hospitalization that either helps you prevent getting severe COVID-19 or helps treat severe COVID-19. Those people who get those antibody therapies for COVID-19 should wait to be vaccinated for 90 days because we don't know whether the antibody therapies might make these vaccines less effective. So really, everyone else can get the vaccine. People with underlying medical conditions like people who are, have weakened immune systems, people with certain inflammatory or autoimmune conditions, people with a history of inflammatory conditions like Guillain-Barré syndrome or Bell's palsy can get the vaccine. Certainly if people have questions, they are, it's always a good idea to talk to your healthcare provider. Women who are pregnant or breastfeeding may also receive the vaccine. Again, people who have questions, we advise them to talk to their healthcare provider. So children and adolescents, as I said before, individuals aged 16 and older can receive the Pfizer vaccine. Individuals aged 18 and older can receive the Mrna vaccine. At this time, the vaccines are not authorized for children and adolescents younger than 16 years. One of the questions we got was, are vaccines going to be available for children and when? There are clinical trials going on right now to look at children younger than 18 years and to make sure that the vaccine is safe and effective in those children. It will likely be that first individuals, kind of older children will be included in trials first, potentially something like children aged 12 to 16 or 18 years. And then after those trials, even younger children, less than 12 years old, will be included. So it will likely be a matter of months before we have children younger than 16 years able to get these vaccines. And it may be even longer for those really, really young children. So obviously that is, important to know for you and your childcare facilities, that it is likely going to be a while until your students are able to get the vaccine. So very common question we get are, of course, what are the side effects? The most common side effects are side effects that we expect with vaccines and that aren't dangerous and that are in fact a sign that the vaccines are working. So the most common side effects that were reported in the trials were pain, swelling, or redness at the injection site. It's what we call local reactions that happen where you get the vaccine injection. Again, not surprising. Anytime you have an injection, you can expect a little bit of pain and redness. And so that most people did report those types of symptoms. More systemic systems, or kind of systems that indicate the immune response through the whole body, things like fever, chills, headache, fatigue, muscle or joint pain, also happened in some people, in the majority of people. These systemic symptoms usually occur pretty quickly. They occur within the first 3 days of vaccination and only last 1 to 3 days. They are more frequent and more intense following the second dose. Again, not surprising because they do kind of represent the immune system working in response to the vaccine. Interestingly, younger people were more likely to experience these symptoms than older people, again, likely due to how strong our immune systems are, and our immune systems tend to get weaker as we get older. Over-the-counter pain relievers like aspirin, Tylenol, Advil can be used to treat the symptoms if needed, but shouldn't be taken only to prevent symptoms. So we did get a question, if people are on pain relievers on a regular basis, should they stop taking them before they get the vaccine? My advice is that if you need to take pain medication for another condition, I wouldn't stop them just to get the vaccine, but I wouldn't start taking pain medications just in anticipation of getting the vaccines. The allergic reactions that have been seen after some of these vaccines have been in the news, of course. So serious allergic reactions, otherwise known as anaphylaxis, have been reported after these vaccines, but it is quite rare. So data collected in the United States from during the first month of vaccination showed that with the Pfizer vaccine, we saw an estimated 5 cases of anaphylaxis for every 1 million doses of vaccine administered. And for Mrna, that was 2.8 cases of anaphylaxis for every 1 million doses administered. So rare reactions. And of course, all the vaccine sites take precautions to prevent these types of allergic reactions, diagnose them, and manage them. So anyone who goes to get a vaccine will be assessed for a history of allergies. All people are observed for 15 minutes after they are vaccinated. People who've had history of allergic reactions to either other vaccines or injectable drugs in the past are observed for a little bit longer, for 30 minutes. And then all sites have emergency medications for the initial treatment of anaphylaxis on site, and plans to ensure that people get, to definitive care if an allergic reaction does happen. We have not had an anaphylactic reaction reported in Wyoming thus far. And I'll just note that all vaccines, including the ones we've used for years and years and years, and of course the COVID-19 vaccines, are monitored continuously while they're in use. Providers are required to report anything that happens after vaccine, even if they don't really think it was related to the vaccine, to the CDC and the FDA through what's called the Vaccine Adverse Event Reporting System, otherwise known as VAERS. Not all events, as I said, are related to vaccination, but events are investigated, and it makes sure we have a continuous ongoing monitoring of the safety of all our vaccines. So Stephanie talked about the priority group. So I'll just end with, so what happens when, after somebody gets the vaccine? So a person is considered immune after it has been 2 weeks since they've received their second dose of vaccine. So those 2 weeks after that second dose give the immune system some time to build up the immunity to where it needs to be to prevent you from getting sick with the actual virus. These vaccines have been shown to be very effective at preventing people from getting sick with COVID-19, but we don't know as much yet about whether someone who's been vaccinated could potentially have COVID-19, not get sick, and spread it to somebody else. We know that as of right now, only a small percentage of the population has been vaccinated, so most people are still susceptible. So we still ask fully vaccinated people to wear masks, physically distance, and stay home when sick to protect others around you who may not be vaccinated. In a childcare setting, this is obviously important because we know most of your students won't have the opportunity to get the vaccine for some time. However, there is some good news. Like people who have actually gotten COVID-19 and are considered to have immunity for 3 months, so don't need to quarantine in the 3 months after their infection if they've been exposed. Individuals who have gotten both doses of the vaccine and it's been 2 weeks since their second dose will be able to follow that same guidance. So if you have an exposure and you're in that period of 2 weeks after your second vaccine and before it's been 3 months since that second vaccine, if you are exposed, you don't need to quarantine. You can continue to work, continue to do your normal activities. I will also note that 3 months is really based on the data that we have now. We do expect that the immunity from these vaccines is going to last longer than 3 months. And as soon as we have the data to know that for sure, it is likely that not needing to quarantine period will last longer than 3 months. I will note that the guidance to not needing to quarantine doesn't apply to a couple of specific groups of people who work in high-risk settings. And so healthcare providers, we do ask them to not work for 14 days after an exposure, even if they are vaccinated, just of wanting to avoid that high-risk scenario of healthcare providers potentially spreading COVID-19 to their patients. And also individuals who live in residential settings like nursing homes will likely still need to quarantine after an exposure if they've been vaccinated because of the high risk and high consequence of COVID-19 spreading in those settings. A couple of other notes. I'm sure you've heard on the news that there are more vaccines in development, and we may have 1 or 2 more vaccines available within the next several months. Again, these vaccines will go through the same extensive trials that these 2 mRNA vaccines have had. We do expect that there will be federal guidance on how we should best manage and use these different vaccines in the population, but it will be very exciting to get more vaccines. It's hard to express how exciting having these vaccines are. We've waited what seems like a very long time. I personally can't wait to get mine when it is my turn. And it really does signal the light at the end of the tunnel. Before I stop, I just want to address some of the questions that Becca sent us today. And one is about, the continued public health orders and guidance that we have in order to prevent transmission, keep transmission levels low, make sure we're not overwhelming our hospital system, while at the same time ramping up vaccination in the hopes that these precautions will not be needed forever, which they won't. So our orders and our guidelines are really, the primary goal is to prevent transmission of COVID-19. But of course, as you're preventing transmission, following these guidelines also makes it less likely that quarantines are necessary and that closures are necessary. We do investigate each situation on a case-by-case basis. I know many of you have experienced this with your county health departments. The best steps that we can take to prevent transmission are mask use when it's possible. We certainly know that it's not possible in all situations, especially for younger children, 2 years of age and younger. To distance as much as possible, that 6-foot distance is really critical, but we also know that it's not possible in all situations. And then to cohort or keep group sizes as small as possible and limit mixing between groups so that if there is a case in the classroom that you limit the number of people that are potentially exposed. We do know that the primary way that COVID-19 is spread is person to person. Spread of the virus from surfaces is possible, but is certainly not the primary way that COVID-19 is spread. So if you have to focus on some areas, I would certainly focus on those measures that prevent person-to-person transmission. And so one question we got was about, sanitizing backpacks upon arrival. If there aren't multiple children touching those backpacks, it's really just the child who brought them in and the teachers. I don't think that's necessary. I would focus more on making sure that the teachers and the students are washing their hands as much as possible over trying to sanitize everything. And then I was asked to share details around the 90-day window of immunity. I touched on this a little bit, but for people who've had COVID-19, and they recovered. The data are very clear that at least within the first 90 days after you've recovered, that it is extremely unlikely that you are going to get COVID-19 because you have built immunity to it. So in those first 3 months after you've had COVID-19, if you are exposed, if you have one of those close contact exposures, you don't need to quarantine. We still ask though that the precautions of distancing and mask use, et cetera, be taken as much as possible. The same 3-month criteria applies to the vaccine. Again, we do anticipate as more data are collected that 3-month period will likely be expanded. I think one factor that has come into play that has made, some of the scientists not want to jump ahead to extend that period is the existence of the variants that I'm sure you've heard about in the news. It does appear that some of these variants, you may be more likely to get reinfected with some of these variants. And these variants are often more easily transmitted from one person to another. And then potentially some of the evidence is starting to show that they actually may cause more serious illness as well. So we want to be happy about the decreasing numbers of cases we're seeing and having the vaccine, but maintain some caution because of the COVID-19 variants and wanting to make sure that we don't start to see them spreading across Wyoming. And then there were a couple of questions on the orders. One question was about 6B, which says that the child care provider shall ensure that staff and children are screened and that logs are kept of the screening, and whether the keeping of logs can be discontinued since it doesn't sound like they've been asked for very often. We think that's a great idea. If we can simplify these orders in any way, we are happy to. And obviously the screening is important, but if the logs aren't being used, then we will absolutely consider removing those in the next set of orders. And there was also a question about dropping children off. I will say I didn't quite understand what the question was there. So if the person who asked that question was on, we'd be happy to answer that one as well. So I think I will stop there. Again, thank you for everything, and certainly looking forward to questions and discussion.
Great, thank you, Dr. Harris. There was a question in the Q&A, and you touched on this a little bit, but it asked how often we will need to get the vaccine in the future. Will it be like the flu vaccine? Will we need to get it every year?
That's a great question, and the short answer is we don't know. I think no one expects it necessarily to be like the flu. The flu mutates very often. And while COVID certainly has had some mutations, it's unclear at this point whether it will be like the flu and we'll need a yearly vaccine, or whether these vaccines are long lasting. So I wish I had an answer. I don't at the moment, but it's a great question.
Thank you. And we imagine there will be more information forthcoming about that and much more as we move ahead. So I don't see any other questions. If there are some, now is a great time to put that into the chat box or the Q&A. We'll watch that for another minute. But otherwise, we just, again, thank you so much, Stephanie and Allie, for your time this evening. And we appreciate the accolades and know that This group of individuals has worked tirelessly for the last year, and indeed so have both of you. And so we appreciate those extraordinary efforts to keep all of us safe and well, and know that continues even now. So the tides are turning, we hope, for you and for all of us, but we appreciate the time that you've spent with us this evening, and know that we'll stay in touch as everything evolves and moves into the future. So still not seeing any questions, but we'll hang on for just a few more minutes here. Oh, Michelle, maybe you're unmuted.
Becca, I know that there was a question earlier in some of the questions about recognizing that none of us can really, we don't have a crystal ball, but if you could imagine what school opening looks like in the fall, would you have any thoughts about what that might look like, and thoughts about how to be proactive about that? Thanks.
Yeah, I think that's also a great question. I wish I could predict the future, but I can't. As you all probably saw, the CDC did come out with new school guidance last Friday. It's quite long. It's about 24 pages long, but you won't really find anything new in there. The recommendations, the sort of core recommendations for masking and distancing really remain their core recommendations, with things like cleaning and hand hygiene, contact tracing, and potentially even screening testing being also, things that can help ensure that schools can be conducted safely and keeping schools and childcare facilities open. I think obviously one of the goals of our response to this pandemic has been to ensure that our hospitals maintain the capacity to care for anybody who needs it. We certainly hope and anticipate that by the time of school opening in the fall, that people who are at the highest risk for severe illness and death from COVID-19 will have had the opportunity to be vaccinated, and we hope most people will be vaccinated. We also know that while most children do have less severe illness than adults and don't appear to be the primary spreaders of COVID-19, they certainly can, but it certainly seems like adults are much better at spreading COVID-19 than children. While on the other hand, though, we also know that severe illness is possible in children and can happen. So we want to make sure that they're protected too. We can't anticipate at this point whether, to what extent children themselves are going to be able to get the vaccine before school starts in August and September. I do think that there will probably be groups of children that don't have access, and maybe particularly the younger children. And so that we will need to anticipate that, and needing to anticipate likely taking some precautions, just so that we can prevent, kids from needing from getting sick, from needing to miss school, and the worst scenarios at them getting very sick and needing to end up in the hospital. But I think that the extent of the precautions likely won't need to be as much as they are now, if that makes sense. So again, I know that wasn't very specific. I do have a lot of hope that, as time goes on, we are going to get closer and closer to normal. Really proud of our schools and childcare facilities that, staying open since, childcare facilities really open since the, beginning. Schools open since August, been able to continue our activities, our sports activities, our performing arts activities. And we really want to make sure that children have the opportunities to do that. And it may mean that we need to continue to take some of these precautions to make sure that children can do that safely.
Great. There is another question in the chat box about instant testing. Can you speak to that? There might be, Steve, if you have specifics about that, let us know, but broadly.
Yep. So there are instant tests available, or rapid tests as we call them. Most of them are antigen tests. So they test for essentially pieces of the proteins that the virus encodes. They are a little bit different from some of the other types of tests that test for the virus genetic material. And so these antigen tests are great because they are rapid. I mean, we're talking results in 15 minutes. They're simple. They can be done by any provider that has what's called a CLIA certificate of waiver. So essentially they have the ability to do these point of care simple tests without complex laboratory oversight. They aren't as good as some of the other tests in that they may miss some people, especially if they're asymptomatic. But if you're doing them repeatedly, then certainly they could have some value, and you do get the results much faster than the results that you're sending out to the laboratories. So a couple of things about these tests. There's at least one school district who is using these antigen tests. They're primarily, my understanding, using them to test students and staff who get sick. That really is the best use of these tests. They certainly could be used to test every student and staff every morning. The problem really with that is less about the science and more about the logistics. Is finding people who can take the samples, run the tests, getting students in. You can imagine that even though 15 minutes is fast, if you're talking about testing, hundreds of students and staff, that certainly creates a logistic problem. There are also actually antigen tests that are approved for at-home use. So you don't need a prescription from a provider. Eventually, it sounds like you can literally walk into a pharmacy and buy these tests, take them home and take them. So the technology is limited right now, and that the supplies are limited. And so we don't have any at the moment. I will say we are working with CDC and asking them, could you help us think about a protocol that we could use with these rapid tests in school and other types of classroom settings? How would we back them up? When would we need to do another type of test, like a PCR test? How often should we be doing the testing, etc. And so we will certainly keep people updated on that. We do have these rapid tests available. So if people are ready to use them, we are ready to send them out. And if people want details on how to get them, I'm certainly happy to answer questions about that.
Great, thank you. And I know I don't see any more questions. We'll keep an eye out for those. Roxanne had a couple of items to share from the DFS lens. So Roxanne, you can jump in now and we'll watch for any remaining questions that individuals might have.
Great, thanks, Becca. And thank you, everybody, Stephanie, Dr. Harris, for this great information. Everybody who is attending, we so appreciate your work and your interest in this. We too, of course, have interest in this. And so as Stephanie referenced, we've been working closely with Department of Health to help coordinate some of this effort for you as providers. Penny Hodevec, whom I'm sure many of you know, put together a great list that she updates weekly, and it lists each county. And so each county is listed, and as Stephanie referenced, they're in different places in regards to their vaccine distribution. So this is a place where you can go and know that this information is updated weekly through different sources, the Department of Health website being the main source, but other local sources are used to update this information. So it's kind of a central location that can be referenced so that you know when your county is distributing vaccines for child care providers, after school providers, those what we like to refer to as essential workers who are taking care of our most precious resources. So Becca, I think you just shared that link out there. Is that the vaccination Google sheet? Okay, great. And so we continually update that. Please let us know if you have any information about your specific county that we might not know about, and we can use that information to update it as well. And then we've had questions and dialogue going on during this webinar about STARS credits. So we have about 3 staff who are actively working that right now to get this webinar certified for STARS credits. So as Becca requested, please put in your name and your email address into the chat so that we know that you attended and we can get that STARS credit out to you We're also going to work on an evaluation piece for the recording. So if you're not able to attend this recording, you can take a small evaluation piece to show that you participated, and we can get you STARS credit that way as well. But those are the updates that I had. And we, again, thank you for all of your hard work, and please let us know if there's anything that we can do to help with this and really get us to the end goal, which is back to some semblance of normalcy. And we appreciate all of you guys just hanging in there as we work through that. And have a great evening. Thank you for your time.
Thanks, Roxanne. There was another question in the chat box about where to get a rapid test or how individuals might go about that. So I don't know if there's an easy answer to that one, or if that'll require some more follow-up. But if there's a way to talk about that, then.
Sure. The first thing that any facility would need is that CLIA certificate of waiver. And essentially that is a certificate from our Office of Healthcare Licensing that says that you have the capability to perform these tests. You're going to have some oversight to make sure the tests are performed correctly. You're going to follow the reporting requirements. Federal law and state law does require that any test results be reported to the Wyoming Department of Health. So I can put in the chat box the link to our Office of Healthcare Licensing website that talks about that CLIA waiver. Any doctor's office or any type of provider, if they're doing things like rapid strep tests, pregnancy tests, etc., they're going to have that CLIA certificate of waiver to show that they can run these tests safely and run them correctly. So once that CLIA certificate of waiver, you have that, then it's really simple. We have a survey up that's public, and it just essentially says, are you a facility in Wyoming? Do you have a CLIA certificate of waiver? And how many tests do you anticipate you're going to use in a month? So you just fill that survey in online, and we get those sent out usually within a couple of days. For those of you that haven't conducted these types of tests before, we're happy to sit down with you and talk about strategies and how you'd report them, etc. So that's really the process. I'll find the links to the CLIA website.
I know too, there wasn't any context in the chat box, so I don't know if this is correct either, but sometimes I know that individuals have hoped for staff or others to be able to get a rapid test. So is there a list of community providers who are offering that rapid test as opposed to the longer length of time test that might be advantageous to access?
I don't think we have a list of types of providers and what test that they're providing. I think, certainly it'd be worth potentially checking with your local health department. They may know. Some of them are running the tests, although I will say that many of them have shift toward focusing on the vaccine appropriately, and since other types of providers can do testing. The rapid tests are great. I think, they do have some limitations, and so it's always good to, talk to us or your healthcare provider about which test, makes the most sense. Sometimes if you get a rapid test and it's negative, you may need to get that PCR type test anyway. It all kind of depends on the situation.
Great, that's helpful. Thank you. Another question just came in about documentation that's needed to provide at the vaccine site to get the vaccine when they are notified that childcare providers are eligible.
That's a good question. Thanks for that. So really what will be happening at the local level is our staff will reach out to the providers. And what happened with school districts is they developed, whatever sign up mechanism they wanted to use for that group. So I don't know that they'll require any specific documentation since our staff will be doing the outreach. I think that, they may ask the person who's the contact of that location, how many people will need the vaccine. And so they'll be making arrangements through that contact person, and they'll let you know whatever documentation may be needed at that time. But since we're making the call to the provider, at that point, the provider can indicate how many people are at that site who may be coming in, and they can discuss those specifics at that time.
Great. I think that should answer that piece. Last call for questions. And if you have all of your questions answered, you are welcome to leave and enjoy the rest of your evening. So thanks to everyone who spent the last almost hour with us. Hopefully your questions were answered. If not, we encourage you just to reach out and stay in touch as we all move through this process together.